Thank you. I'm from Brunel University. So, interesting fact about Brunel, we're the only university named after an engineer, so that's why nobody knows where we are. Or if they do think they know where we are, they think we're in Bristol. Actually, we're in Uxbridge. And we're going to be 50 next year, so do come to the party. It should be fun. And I'd like to introduce you to Mr. Brunel. That's one of the shorn the sheeps that are around the City of London. I think there's 100. I'm looking at Jitco. There are 100, and there's a lot of them. So you can print off a map and go shorn the sheep spotting. It's for the children's hospice or something. And Brunel graciously sponsored one. As you can see, he's Mr. Brunel, which you can distinguish by his hat. So Brunel was a very short man, so he had a very tall hat. So, okay, so. I'm sorry to drag you in from the sunshine. Perhaps we should have had this outside. And my job is the postprandial entertainment. And in some ways, I feel a little bit like a climate change skeptic at a Green Party conference, because I want to get using the example of some work I've been doing, which was a literature review about looking at the relationship between loneliness and dementia. To perhaps get us to think a little bit critically, particularly for the researchers, what are the research questions we're asking? Are they the right questions? And kind of why are we doing it? And to remind us not to lose our critical faculties when we're undertaking these activities. So if you invite me to leave afterwards, that's fine. It's a very nice sunny day. So this is based on a piece of work that is a spin-off from something called the IDEAL Project, which is a ESRC, NIHR-funded project looking at living well with dementia. And it was a literature review stroke evidence synthesis that was commissioned by the Alzheimer's Disease Society. And I had the help of a couple of people, my colleague Jitka, who's in the audience, and Rachel Woodbridge in writing the report for the Alzheimer's Disease Society. However, they bear no responsibility for any of the comments or interpretation that I might make. So all criticisms my way. And this particular project got me thinking about two things. Got me thinking about dementia. Currently, dementia is a key public health challenge, and there's a great deal of activity focusing on what's the cause and what's the cure and how can we identify it. So here's a few random pictures. So if you're a Daily Mail reader, at least once a week on the front page of the Daily Mail, it's either new test can predict dementia, or it's an activity that we do that either puts you at risk of dementia or not at risk. So eating chocolate is either a risk factor for dementia or a protective factor, as is drinking red wine. You can make your own choices, you're consenting adults. Similarly with using mobile phones. And I think last week it was obese people are less likely to get dementia. So there's a lot of kind of interest looking at that. And also is running sort of parallel, so this links my two interests, is this narrative about loneliness. Now, I'm an academic. I have no useful transferable skills. I'm not a policymaker. I'm not a practitioner. I can't do anything useful. So my interest in loneliness is an academic one. And I've been studying this for more years than I care to remember. But there's a pretty familiar narrative that we see all the time. Loneliness is a product of modernity and is a reflection of the kind of uncaring, fragmented society that we live in. And we describe it very negatively. So we are now talking, there's a whole vocabulary about the epidemics of loneliness. And we're looking, loneliness is contagious. And we can cure loneliness like this. So we've now found a gene for loneliness. So if you can just modify that gene, nobody will be lonely. So I think there's some really interesting narratives about about how we're presenting loneliness, yet we know we never ask them from what for me is the most interesting question, which most people in the audience have heard me say before, is 90% of people are not lonely. Given the vicissitudes and changes and challenges of life, that strikes me as being completely remarkable, that we're not all lonely all of the time, because it... So I think for me, there's a real backstory there about what is so fascinating about loneliness. And for me, it's about the degree to which loneliness is part of the human experience. It's part of what makes us human. It's one of the dimensions of being loneliness. But increasingly, the research agenda around loneliness is being very much focused on health consequences. And so, and there, as we've already heard, there was a recent literature review looking at mortality and loneliness, and we've heard lots of data linking loneliness with a range of negative health outcomes. And it's quite clear that social relationships are very important for our quality of life. But I'm kind of intrigued as to the degree to which why we're interested in mortality or physical health, whereas the whole of the government agenda allegedly is now around well-being. But actually, the thing that drives a lot of the loneliness agenda is around poor health outcomes. And I think that's a kind of interesting debate about how research in loneliness perhaps is becoming medicalised, and what is a normal part of the human experience, perhaps parallel with childbirth or some other of these things that we experience over the life, is now being seen as a medical problem. So there are plenty of people who are happily trying to find the gene or the prescription to do it. So I'm just asking the question. I'm not necessarily saying it's a bad thing that we do this, but it seems to me that there is no research, to the best of my knowledge, that looks at the positive aspects of loneliness. Is there a positive aspect? So part of the job of an academic is to try and turn the question round, or try and say, are we colluding with a kind of medicalisation of a common human experience, and or are we, by engaging in that, not asking some other questions about health experiences in contemporary society? It's seeing that occupation in the other building. It's kind of driven me back to my student moment. But I think we should all ask, who wants to know the answer to this question and why? So, and I think as social scientists, so I'm a failed geographer, to some degree, we're being... there's a bit of a tail wagging the dog here. Social scientists are increasingly looking at these negative aspects and being channeled down a kind of biomedical agenda, and we're not really perhaps thinking from our own disciplines the kinds of interesting questions we might want to ask. And you could feel free to disagree with me later on. And so for me, this is where I started on this issue with loneliness and dementia. So now there's a huge risk here, and I just have to look at my paper every now and then, because this could turn into a postgraduate MSc in Public Health Research Methods lecture. So I'm going to have to contain myself here. So this was a piece of Dutch research from a study using the Amsterdam Longitudinal Study of Ageing. And the important part, and where the Alzheimer's Disease Society, in discussion with us, wanted to understand this a bit better, which is that the absence of social attachments, not necessarily loneliness, increased the risk of cognitive decline. And this particular piece of work, rather similar to the systematic reviews that we've seen, then generated a huge amount of headlines. So I won't name and shame Duncan Selby anymore about his loneliness is worse for you than being, smoking 15 cigarettes a day. And as a critical social scientist, you say, really? The one thing we know is really bad for you is smoking 15 cigarettes a day. And is loneliness there? Maybe it is, but we need to kind of not disengage our brain just because this particular statement is the pathway to research funding. For those of us who need to do that. Okay, so I got interested in this, and this particular piece of research was very much presented as loneliness causes dementia. And for a researcher, there's a very important, but perhaps to the lay audience and the media in particular, there's a very important distinction between association and causation. So, left-handed people die younger than right-handed people. Well, is that causal? So, this is where I came into it, and I had a little look at the literature, and the quote from Dr. Johnson is just light entertainment while I prattle on about research kinds of things. And when we're looking at these relationships, we need to think about two things. How do we measure dementia, and how do we measure loneliness? So when we start to look at the literature, we find there are lots of different ways in research to measure loneliness. And there's just a couple, going from a complete clinical examination through to the use of something standardised screening tool, through to performance on the kinds of cognitive tests that Aperna talked about. And so particularly when we're thinking about some of these, we need to think about, well, what's the normal value? How well do things like recall, delayed or immediate recall, or listing animals actually link to dementia? How close are those relationships? And are there clinical thresholds? So when we're reading the literature, and as interested citizens, and this applies to cognitive, other health issues as well, how have they measured this? And of course, I can get on to my favourite topic, which is how you measure loneliness. And so we present this as being very straightforward. You should use the de Jong method, or you should use the UCLA score, or you should invent a new score. This is one of our participants who, of course, very helpfully said, actually, it's a really difficult thing to do. And if you start to go and ask people, what do you mean by loneliness? What does it feel like? How would you define it? It is actually a complex phenomena, which when we use the kinds of tools that we do, because that's what we do, we just need to contextualise them by underneath a score of whatever it is on the UCLA scale or the de Jong scale. There is actually a complex human experience. And this guy, who's a philosopher, far too deep for me, as I say, I'm a failed geographer, but actually, how can we, as researchers, actually capture what it means? And perhaps the reason some of our interventions don't work is actually we don't appreciate the complexity of the phenomena we're actually trying to engage with. So now I can talk about what I really, really like. I have those people in the audience who know me know I have very strong views on measuring loneliness. And for me, it's a choice of two. Like Ness, I'm a fan of the de Jong-Gerveld scale. We're not paid commission, so because I think it's a really good scale. It has a proper theoretical foundation. It has a proper protocol for administration, and all the kinds of things you want in a measurement tool are present in that. The UCLA scale, I'm not a fan of, but I won't go into that. And also, actually, I'm on the sort of radical wing of the loneliness researchers. Actually, I think there's no problem with it. I've never had any problem asking people questions directly about loneliness. Maybe they feel sorry for me and just answer it. Who knows? And actually, at the severe end, there is a very good overlap between people who score very highly on the de Jong scale and people's answers to a self-rating scale. And my own view, and these points are relevant to thinking about the evidence, my own view is it's very patronising to decide in advance that somebody is going to be offended and stigmatised. I think I should ask the question, and it's their prerogative to tell me to go away. I think it's, or not answer it, or any of those other things. So I think we do need to be clear, and I do have a problem, so I'll come out. I do have a problem with lots of people, first of all, starting from a position of thinking older people cannot answer this question, and secondly, then thinking we'll develop our own scale. Developing scales that have any meaning and that are going to be useful to organisations is a very complex task. So, and you can take me to task about that later. So this is the data I got, and I had 2 questions that I wanted to ask, and I shall try and be fairly brief. These are the studies that compare levels of loneliness between people who are defined as having dementia and without dementia, so in the general population. And broadly, there are 4 studies where you have a prevalence rate. So, can't get the do. Anyway, okay, so where is it? Oh, okay. I have to do something. So here we are. This particular study says 33% of people with dementia are lonely versus 22% who aren't. So of the 4 studies, probably 3 of them give you a higher level of loneliness amongst people with dementia as compared to people without. So there may well be some evidence that people with who have dementia experience more loneliness. But of course there are lots of other factors that could explain that. It could be that people with dementia are older, are more likely to be widowed, have a range of other problems that might explain that. So as critical researchers, we need to think about, is it the fact that they've got dementia, or is it the fact that they're widowed? And we need to otherwise we run the risk of trying to solve the wrong problem, which also may not help us if we feel interventions are appropriate. So I will skip over the next one because that's just more of the same, and I think it's interesting, but you probably don't. But then we have studies that show association. So those are just giving you the prevalence rates, don't do anything else. We then have a range of studies that are single point in time, cross-sectional studies. And so there are 5 of these where they say, loneliness is correlated with these outcomes. And that's good. But when you then take into account all of these other underpinning factors, you actually find that 2 studies show some evidence that people who were lonely performed worse on a series of verbal fluency tests, so the animal naming. So are they performing worse on those tests because they're lonely, or is the fact that they're performing worse on their tests making them lonely? So I can't go out because I can't name 10 animals in a minute or whatever it is. So we need, as researchers, when we're presented with this kind of evidence in the media or elsewhere, to just actually think, which way's the causation going? I'm sorry to be teaching my grandmothers to suck eggs, but I think it's really important, and we don't advance our subject if our data are not credible. It's very important that if we're going to convince people to take loneliness or dementia or whatever it is seriously, that actually our evidence stands up to scrutiny on something more robust than the front page of a newspaper. Okay, so you'll be pleased to know that the end is nigh. The best way to do this is to look at longitudinal studies. So Pernas and Ness have already mentioned that. And there are actually 2 studies that have done this. So you take a sample of people who are assessed by psychiatrists at baseline, who are don't appear to have impaired cognitive function. You get them to answer a question on loneliness. You follow them up and see what happens to them. So you measure loneliness once, and then in the case of Wilson, you measured it more times, and then you find out what happened to them. And this is a really, really good study, which I would, anybody who's interested in teaching research methods, do use that paper, because it's epic. Because this is one of the key studies, and it tells you that you're 30% or 50% more likely to have dementia if you're lonely. And then you look at what he did. So he used the 11-item de Jong-Gerville scale, decided he didn't like 5 of the questions, so didn't bother to ask them, then had 6 questions and thought, I don't really like that, I'll have 5. So merged 2 questions together, and then changed it from European English into American English. And this is just 1 sentence. So here is a paper that says we've used a credible tool, when in actual fact it's a messed around tool. So I think it's really problematic if that's our if that's our gold standard of conducting research, that's what we're going to quote to policymakers, I think we need to up our game a little bit. This one is much better. Where has it gone? The one by Hellwerder, which was a more rigorously conducted study in terms of how they measured loneliness and also how they assessed cognitive function. And again, it's really important to understand what that data is telling you. It's not telling you it's causation, it's telling you somebody's at greater risk. So somebody who is lonely is at greater risk, 60%, 50%, whatever it is, more risk of experiencing dementia than people who are not lonely. And so we have to be very careful in what in how we present that. So that's just really, I'm glad I've got that off my chest, thank you very much, but I just think we have to be careful and be confident in what we're doing. So to go back to what I was asked to do by the Alzheimer's Disease Society, is loneliness a cause of dementia? Highly unlikely, I would have said. What's the mechanism if it is? If it is, who knows? Is loneliness a consequence of dementia? I think there is much more intuitive credibility for that as a conclusion. It does come across an excess of dementia in people, an excess of loneliness in people with dementia across a range of studies, in a range of different settings, using a range of different questions. And I guess that's not surprising. And that says as much about how we treat and engage people with dementia in society as anything else. So if we really want to solve the problem of loneliness and dementia, rather than looking for a cause or a cure for dementia, maybe we'd be much more effective if we engaged older people with dementia in society much more, as in dementia-friendly swimming. This is my aspiration for when I grow old. I've got the ASA to create a special programme just for me. So that's just a little kind of something I felt I had to share with people. I feel much better now I've done that, and thank you for your patience. And the other opportunity I have is a bit of shameless self-promotion. At Brunel with some colleagues, we have an ESRC seminar series, and our first seminar is on May the 8th. If you want to come along, you're most welcome. There's the website. Ness is talking. It will be brilliant. So please come along and join us. Thank you for your patience.